VA is the largest integrated healthcare system in the United States. At the same time, one of its important related missions is educating healthcare professionals for the future. So what I want to talk with you about today is aligning education with the system redesign, the clinical redesign that is going on within the Veterans Health Administration at the moment. And then with that by way of background, I'll be able to talk about the primary care educational system redesign. And I'll be using there as the example our new VA Centers of Excellence in Primary Care Education. Now, perhaps the most important principle to start with is that one cannot redesign the educational system without at the same time redesigning the clinical care system. In fact, the tail does not wag the dog wags the tail. And the tail is education. The dog is the clinical care system. So if we're to think about a redesign of educational elements, we need to frame that within the context of the clinical system redesign. Now, at the middle of the clinical microenvironment is the patient. VA has a new system of patient-driven healthcare in which the patient makes the decisions around what he or she may need. So the patient is in the center of this clinical microsystem. The patient is surrounded by caring. That is a series of healthcare professionals, both trainees and staff healthcare professionals, who care about the patient and deliver care to that patient. Now, caring is not the same thing as delivering care. In the VA, we are most concerned about our attitudes and our behavior in caring for all aspects of the veteran's expectations and needs. At the same time, a component of that is actually delivering health care, obviously, to the individuals that we manage. Now, related to the caring piece is a learning piece. And the more we care about and for the patient, the more the trainees in the system learn about how to deliver care in the future when they develop independent practices. So we really have a dynamic interaction here in which learning and caring centered around the patient is a continuous process in our hospitals and clinics. So the important point from what I've been trying to get across at this point is to realize that in changing education, one needs to take into account continuously the impact of changes in practice, in the clinical practice redesign as well. Now, within that clinical care system is our VA education system. And the background to that is that it's the largest clinical education system in the United States. It involves the training, the clinical education of over 40 different health professions. Every health profession in the United States is essentially included in our training programs. In the past year, nearly 120,000 individual trainees rotated and did clinical work in the VA. Of those, there's about 38,000 physician residents and 20,000 medical students, and about 26,000 nursing students, and 32,000 of the other associated health professions, such as psychologists, social workers, and so on. Now, to move to the educational issues, if we knew how to change education to bring our trainees to the front and center of the packed primary care model, we would simply go about doing it nationally. But we don't know exactly the best way of moving from point A to point B, that is, getting this change involved. So one of the approaches to that was to develop 5 new centers of excellence in primary care education, to use them as laboratories, essentially, to see how best on a more national level later on we could change the educational model to adapt to the clinical delivery system that we're creating in the VA. The collaboration between the faculty, particularly across professions, in curriculum revision, that is designing the learning experiences, is particularly important. Without that, it appears that one profession will end up dominating the curriculum, and that's not what we want. We want equal input to these curricula from all the professions who are involved. I must say that this is very, very hard work, and burnout, particularly of the leadership people, has become a significant problem. And so we need to develop better mechanisms of support for the leaders who are doing this very hard work.